Hi, I'm Alan Unell. This series of videos is Healthcare Advocacy, where we look at problems in the healthcare system and try and make a better system for all of us. I apologize, we've been not producing these videos for a couple of weeks because we've been out of town, but we're back now. So remember, down below you can find links to the Healthcare Advocacy newsletter, and all the reference material is there. I want to talk about single-payer universal health care. I came across a really interesting example, and I'd like to share it with you. For more than 4 decades, state Medicaid directors have paid private health insurers to manage the care of their Medicaid beneficiaries under comprehensive risk-based contracts. Today, Medicaid managed care, as it's called, is pretty much the rule, not the exception. 40 states and the District of Columbia run their Medicaid programs that way. Since 2012, Connecticut has gone against the grain of this trend. Late in 2011, the state ended $800 million in contracts that it had with Aetna, United Healthcare's AmeriChoice, and a nonprofit insurer called Community Health Network of Connecticut. It assumed full financial risk for the 529,000 people in the state's Husky Health Program. That's their Medicaid. And that included adults and their family members that were in Medicaid, together with children that were in CHIP, the Children's Health Insurance Program. That's Medicaid for kids. Connecticut adopted a self-insured system similar to what large employers use and contracted with 3 companies to provide administrative services under what's called an administrative services only contract. And all they did was approve payments for hospitals and physicians and other providers. And they served only to facilitate the payments. That's it. The state would assume all responsibility for making sure the money was there. So it's not particularly important, but the 3 ASOs were Beacon Health Options for behavioral health, Benecare for dental, and CHNCT for medical claims. Now, it's also worth noting that when managed care organizations were fired, the number of physicians that were willing to participate went up by 1/3. Now, doctors don't do that unless the system is working in their favor. In 2019, Connecticut's annual spending for Medicaid and CHIP for each enrollee was $8,405, just a hair below the median annual Medicaid spending level of $8,436 for all states and territories, according to Medicaid.gov. Now, that level of spending is impressive, not because it's the average, but because Connecticut's cost of living is one of the highest in the U.S. And with a more expensive cost of living, you tend to have higher healthcare costs because labor and other expenses are also greater. You'll find a link to this story in the newsletter. So let's recap. Connecticut decided to implement Medicaid with a single-payer trust, instead of paying insurance companies to create managed care networks. They paid companies to administer the claims only, and the number of doctors participating went up by 1/3. The system serves well, costs less in an inexpensive marketplace, and everybody seems to be pretty happy with it. So, score 1 for single payer. What you can do, share this example freely, because it's another example that single-payer universal health care really does work. Let's talk a little bit about reproductive health care. There are some news stories on this I wanted to share with you. First, America, all of us, wants reproductive rights restored. Almost 2 years after the Supreme Court overturned Roe v. Wade, most Americans still support abortion access. More than 6 in 10 Americans think abortion should be legal in all or most cases, according to a new Pew Research Center survey of about 8,700 adults released this past Monday. The share of American adults who believe abortion should be legal in all or most cases increased by 4% since 2021, according to Pew. Accordingly, you can check the statistics from the Pew Research Center over 24 years if you look down in the newsletter that's linked below. I have a chart, and you can see that this is the highest it's been in the past 24 years. That says something. Anyway, remember that abortion care is a necessary part of women's reproductive health care and is needed to save so many women's lives and fertility. Let's talk about Louisiana. Louisiana now seeks to criminalize some abortion medications. This is a hard one to believe. According to Axios, Louisiana is moving to criminalize possession of 2 medications used to induce abortion without a prescription, with punishments including prison time. Just take a deep breath. If it's approved, Louisiana would become the first state to categorize mifepristone and misoprostol as controlled dangerous subjects, a class of drugs that includes medications that can be abused, like narcotics and steroids and depressants. Really? You know what? That bunch is just hateful. Okay, Arizona Supreme Court has stayed the 1864 abortion ban. This is sort of a technical news story. They did it because, let me just read it to you. The Arizona Supreme Court this past Monday, granted State Attorney General Chris May's request to delay enforcement of the state's 1864 abortion ban, preventing it from taking effect for the next several months. The state's high court granted a 90-day stay of the 1864 law on Monday, meaning the ban cannot be enforced until August 12th. Combined with another court case that's winding its way through the system, the stay is really in effect until September 26th. It comes weeks after Governor Katie Hobbs signed a repeal of the ban by the state legislature. The repeal, however, here's the problem, does not go into effect for 90 days or until the legislature adjourns. So they're just keeping everybody safe for that 3 months. Combined with Monday's ruling, enforcement of the 1864 ban may never take effect. That would be good, though it depends on when the state legislature adjourns, and currently there's no end date in sight. I think they should all go home now. Speaking out against abortion bans, Kentucky Governor Andy Beshear's upcoming trip, he's going to Tennessee to speak out against Tennessee's sweeping abortion ban. It is the latest sign that the Democrat, who is known for defeating Donald Trump-backed rivals, is looking to improve his party's prospects in GOP territory and probably build up his own name recognition. Beshear campaigned against his state's near total abortion ban in winning re-election last year, and he's going to speak next month at an event called Championing Reproductive Freedom. Let's take an action. This states' rights thing is just a sad excuse for banning abortion and punishing half the women in the country. There's a link down below. You can call or email your member of Congress and your senators and remind them we need them to dwell long and loud and often that women are full citizens and bodily autonomy is a part of that package. You can also use ResistBot on your cell phone. You can send a text message to 50409. Here's the message. Sign, SIGN, space, PTCOYJ. PTCOYJ to 50409, and it'll essentially say the same thing. I'm your constituent. I'm fed up with this country's treating women as less than full citizens without bodily autonomy. According to the Pew Center, 63% of Americans want abortion legal. I want you to be a loud advocate for the Women's Health Protection Act and restore the right to reproductive health nationwide. And I'm going to be listening, I promise. Let's talk briefly about colon cancer rates, because this is a shocker. First came public pleas for millennials and Gen Zers to be aware of the signs of colon cancer. That was kind of new, which has seen such a rise in young adults that it's now the #1 cause of cancer death in men under 50 and #2 in women under 50. What a shocker. This is like brand new. This week, though, that plea expanded to adolescents with news that colorectal cancer rates among kids between 10 and 14 and teens 15 to 19 have risen by 500% and 333% respectively over the past 20 years. Now, I know those percentages are incredibly alarming and they're super high, but it's worth noting that the actual number of cases is low. In 2020, only 0.6 children between 10 and 14 per 100,000 population were diagnosed, and 0.1 per 100,000 in 1999. So it went up from 0.1 to 0.6 in that 20-year period. For teens, it went from 0.3 to 1.3 in that same period. And young adults went from 0.7 to 2 per 100,000. Okay, it's not a lot of people, but it is really concerning because it has never been this way before. Okay, so what do we need? Diet, alcohol use, low fiber in the diet, those are all contributors, as are potential genetic predispositions. But you know, if it was genetic predisposition, you would think you would have seen it somewhere in the last 20 to 50 years, but there wasn't much of it there. Now, one investigator thought there might be something more subtle going on under the surface, like a change in human gut microbes. That could explain it, but you know what? They don't have enough evidence yet, and more investigation is needed. Because these kinds of cancers in young people were virtually non-existent in the past. That's why they're looking at changes to gut health overall, because it's occurring in so much more of the population. It's something to think about. Anyway, signs and symptoms of colorectal cancer are the same in children and teens as they are in adults, the most common of which are changes in bowel habit, abdominal pain, signs of iron deficiency, anemia, rectal bleeding. Bottom line, if the symptoms are present, get to a doctor. If there is a young person in your sphere of influence, share the information with them. They might think you're weird, but just share it just so they're aware. Just park it in the back of their mind. Okay, here is a wacky story from my state, Washington. Goat milk is not sufficiently nutritious for babies, according to the FDA. A Washington-based company is recalling a goat milk product and urging consumers immediately to stop using the product for baby formula. Healthwest Minerals, doing business as Mount Capra Products of Chehalis, announced on Friday, last week, that it is recalling 1,506 boxes of goat milk formula recipe kit on the advice of the FDA because the product does not provide sufficient nutrition when used as an infant formula. It's probably fine for adults if you just want to drink goat milk. I can't imagine it myself. Anyway, that's what I've got for you today. Down below, you can take the action. You can like, share, you can subscribe. Please share this thing. And click on the Healthcare Advocacy newsletter there. You can subscribe there for free. I take no money for that because I retired. Okay, have a good day. We'll talk to you next time.